Welcome to the fifth edition of Spotters and Boosters. To the homework for SDL 4 R. First question was, what is the other use of primaquine apart from radical cure of vivax oval malaria? The answer is an alternative drug for P0AC causing pneumonia. It is usually given with clindamycin, and this infection occurs usually in HIV/AIDS. Question 2 is, which anti-malarial drug is also effective in toxoplasmosis in HIV/AIDS? The answer is higher doses of pyrimethamine. Question 3 is, an anti-leprotic drug which is drug of choice against dermatitis herpetiformis. It is Dapsone. Is used in both these conditions, and the second condition, it is drug of choice. Question 4, a macrolide antibiotic used against acne vulgaris, mycobacterium aviae-complex, T. gondii and leprosy is clindamycin. Question 5 is, a macrolide effective against Clostridioides difficile is phentermine. It is an oral. Question 6 is, what is the common denominator among rifaximin, fidaxomicin and neomycin? These all are given orally and are minimally or not at all absorbed, but they are indicated in different conditions related to alimentary canal. Rifaximin is used in irritable bowel syndrome when it is diarrhea prone. It is also used in the treatment of traveler's diarrhea. Neomycin is used for bowel sterilization before surgery and in the treatment of hepatic precoma. Question 7. An antibacterial drug that inhibits DNA gyrase 4 in gram-positive bacteria. The answer is fluoroquinolones. You may name any one of them, for example, ciprofloxacin, ofloxacin, moxifloxacin, levofloxacin, sparfloxacin. All of them will have similar mechanism of action. Question 8 is, an anti-malignant drug that acts by inhibiting topoisomerase 1 in the malignant cells. The answer is irinotecan. Question 9 is anti-cancer antibiotic that inhibits topoisomerase 2 in malignant cells. The answer is antibacterial daunorubicin. Question 10 is, cephalosporin effective against anaerobes, that is bacteroids and some non-tubercular mycobacteria, for example Mycobacterium abscessus, is cefoxitin. It belongs to second generation, actually not third generation. Generally, cephalosporins are not effective against bacteroids. Only a few of them are effective. Among them is cefoxitin and cefotitin from second generation and ceftriaxone from third generation. Others are not effective. The spot 1 for this edition is, identify the lesion, name a drug which is effective in this condition, and when should the drug be started. This is a lesion in 75 years of diabetic male who developed painful vesicular lesions involving T6 dermatome on the left side of the chest. Larger view is also shown, and larger view shows vesicular patchy lesion in dermatomal distribution. Answer is herpes zoster caused by a Venezuela zoster virus, and this usually occurs in the form of a dermatomal vesicular lesions which are painful, itchy, and later they discommit. The drug of choice is acyclovir, valacyclovir. Any of them can be given. Acyclovir is a time-tested drug, most effective when given as early as possible onset of the eruptions. If eruptions occur and later is given, its efficacy decreases. So it should be given within 72 hours of the onset of eruptions and continued for 7 days or more. Acyclovir can be given. Valacyclovir is also available as a prodrug with higher bioavailability, and famciclovir is also available for the treatment. They are also useful for the treatment of spot 2. Mention one drug each that mainly acts at the site X and Y in the drainage of aqueous fluid. Now, one drainage is trabecular outflow and the second is uvascular outflow, including episcleral flow. Now, drug X affects uvascular flow and Y affects trabecular flow. Drug X is pilocarpine that increases trabecular outflow by causing meiosis. The other drug which can be given topically to reduce trabecular outflow significantly is a Rho kinase inhibitor, nitarsudil. Pilocarpine is infrequently used today. There are many other drugs available. Trabecular flow is also enhanced by many other drugs, particularly adrenergic agonists and apraclonidine, and is also enhanced slightly only by prostaglandin analogs. Y drug is a prostaglandin analog, latanoprost, bimetoprost, travoprost. Now these drugs act mainly by increasing uvascular flow of the aqueous humor. Spot 3 is identify drug A and B in the pictorial site. Drug A appears to inhibit alcohol dehydrogenase and drug B appears to inhibit aldehyde dehydrogenase. The side of the row, if you see, alcohol dehydrogenase appears to be important for methanol metabolism and treatment, whereas aldehyde dehydrogenase appears to be important for the management of ethanol toxicity or chronic. The answer is A is fomepizole, an alcohol dehydrogenase inhibitor. It reduces rate of formation of formaldehyde and formic acid from methanol. Therefore, it is used in the treatment of acute methyl alcohol poisoning, and thereby it reduces toxicity to eye. Whereas drug B is a disulfiram that irreversibly inhibits mitochondrial and cytosolic aldehyde dehydrogenase. Therefore, there is accumulation of aldehyde causing aldehyde syndrome, and this patient cannot tolerate frequently, and therefore he develops disliking to take alcohol. Therefore, disulfiram is used in the treatment of chronic alcoholism, whereas fomepizole is used in the treatment of acute methanol poisoning. Now, patients on disulfiram should avoid hidden forms of the alcohol that may also cause itching, redness, and palpitation. For example, aftershave lotions, UD color, some perfumes, scents, sauces, fermented vinegar, cough syrups, any liquid form taken orally that contains alcohol. Spot 5 is identify an antiplatelet drug that does not require bioactivation by metabolism after absorption. Here, the importance is that there is a drug that doesn't undergo hepatic activation after giving it orally. Whereas clopidogrel undergoes two-step activation, prasugrel undergoes one-step activation. The third drug doesn't undergo any activation. It is active by itself and has antiplatelet action by inhibiting P2Y12 receptor directly. Of drug A could be cangrelor or ticagrelor that are directly acting inhibitors of P2Y2 receptors. They are actually reversible inhibitors. Cangrelor is used IV during cardiac procedures, whereas ticagrelor is available orally, and it has been used alone or along with low dose aspirin, but the dose of aspirin should be less than 100 mg because in a large multi-center trial its efficacy is reduced. There is a clear antagonism when dose exceeds 100 mg of aspirin. Compared to clopidogrel, the antiplatelet effect of ticagrelor are greater, more predictable, and quicker. Therefore, it is a dependable antiplatelet to be used, particularly in those patients who cannot tolerate prasugrel or clopidogrel, or patients who have genetic variation in the metabolic enzymes that may show failure, non-functional genes that may show non-functional genes, therefore clopidogrel activation suffers, or there is a concurrent use of drug that interacts badly, adverse. Spot 6 is look at the pictorial and name drug X that inhibits spinal polysynaptic pathways to induce muscle relaxation. And what is the use of it? The spinal polysynaptic pathways, actually spinal and supraspinal, inhibited by centrally acting skeletal muscle relaxants. Examples are baclofen, which is used in the spasticity of multiple sclerosis and spinal cord injury, diazepam, chlorzoxazone. Spot 7 is identify drug X and mention one use of it. Here there is a portion of gut in which there is a cholesterol. In gut, cholesterol comes from diet as well as from enterohepatic recycling. Now this cholesterol gets absorbed at the site marked as X where drug is actually acting. Now that means drug is not allowing cholesterol to be absorbed. This is the main pictorial. Drug X prevents absorption of cholesterol from gut by inhibiting a transporter protein in the intestinal mucosal cells. And this drug is only one, that is ezetimibe. So ezetimibe is a drug that is mainly used as an add-on drug along with statins for the treatment of hyperlipidemic disorders in patients who have high cardiovascular risk. Now, homework for self-directed learning. Question 1. An antihistaminic that has anti-vertigo action due to calcium channel blocking action thereby inhibits vestibular sensory nuclei. Question 2. Enumerate drugs that can cause disulfide alcohol intolerance. Mention a few drugs used to prevent relapse in chronic alcoholics who have quit after aversion therapy. Question 4. Can we use fomepizole in ethanol intoxication? Question 5. A tetracycline that causes vestibular toxicity. 6. Which type of cephalosporins shows disulfiram-like reaction? Name a drug that acts at an early step in the cholesterol biosynthesis, and the step is earlier to HMG-CoA enzyme change. Mention an antidote for heparin, fibrinolytic, and ticagrelor, and they are available actually. Question 9. A long-acting lipid-lowering agent that remarkably reduces LDL cholesterol by over 50% and is used injectable once in 3 to 6 months. Question 10. An orally effective iron chelating agent used in chronic iron overload condition caused by repeated blood transfusions as is seen in thalassemia. So you may find answers in the standard textbooks. They are not very difficult and they are at undergraduate level. Thank you and happy learning.